Thank you so much to everybody who's joining us today, and a special big thank you to our expert panel who've given up their time today to show solidarity with all of the schools of our system, and to give everybody the opportunity to come together to work out how we as a group can best support our children and young people as we prepare to welcome them back into the school sort of our system. So I think everybody's sort of has seen the agenda. Hopefully everybody's seen the rules. So so it's Chatham House sort of rules. Feel free to ask sort of questions without constraints. But let's try and keep it apolitical. Let's try and sort of keep it so like our mums would be happy if they overheard what we're sort of saying, and various other sensible sort of rules like that. We will be monitoring questions as we go through. So the last time we did this, it was really the question and answer session, which I think everybody found really, really sort of productive and helpful. What else should I sort of say? We are recording this, but it will be edited very, very carefully. We're actually recording it through a different system this time, so hopefully the end result will be really high quality. And we'll make that available. One of the things that we are doing in conjunction with this event is producing a booklet that we hope will be full of advice and actually hopefully give everybody within the school system a one-stop shop where they can go and just see some of the general support which is available throughout sort of a district, but in a very streamlined way, so that hopefully we'll sort of cut through some of the sort of mess so everybody can sort of see where there are resources, where there's support around, for instance, mental health and the like. So I think without further ado, we'll just sort of start. So if I can hand over to John, who's going to start today.
So, and the first slide is just what we've been living through in the hospital for the last few months. But remarkably, things have changed quite dramatically. Next slide. Sorry, so no, not that dramatically. Sorry, yes. So you can see how much of an age-related illness this is. This shows the mortality from COVID-19 by age. If you're over 80, you've got 100 times the risk of dying than if you're 40. And as you get younger, the risk gets smaller and smaller. And you'll have seen the statements from Chris Whitty over the weekend. Next slide, please. Also, what we've noticed is it is very socially patterned, and there's been lots of discussion around that, which are linked into ethnicity. Ethnicity is a marker of deprivation, population overcrowding, housing overcrowding, low-paid workers who are having to go out. And it's very noticeable. And in a city like Bradford, which is skewed very much towards the more deprived IMD quintiles, it's very obvious. Next slide, please. Just gone up, down. So this is our epidemic curve in Bradford and Airedale. This is the hospital. The hospital data is in the blue at the bottom, and you can see over the sort of peak that hit us in the end of March. Somebody's not on mute.
Nicola, I think you're not on mute.
So you can see, we were seeing this traditional, typical epidemic curve in March, April, May. We've just got a handful of patients, and we've had a handful over the last couple of weeks. So it is noticeably, almost back to normal, dealing in a very different way with patients and trying to encourage people to come back to healthcare. What we also see is the cases in the community. So this is what we call Pillar 2. More of the community testing. And this has been the thing that's been causing us anxiety across the district. So while the hospital has become very quiet, we have been testing increasing positivity across the district. And that led to that sort of clunky whack-a-mole approach with the additional restrictions. After Leicester was locked down, we had additional restrictions along with Manchester and Blackburn. So the good news is that in the last few days, in the last week or so, things seem to be heading in the right direction. Numbers of cases are down to about 40, incidence is about 43 per 100,000. At its peak, it was in the late 50s. and case positivity, which is also important because we're going to pick up more cases by testing more, obviously. And Bradford, we are testing a lot, so we're going to pick cases up. Case positivity is an important indicator, and that's gone down to about 4.3%. It was close, it was over 6% at one stage, which was worrying, but that seems to be settling as well. So things are heading in the right direction. I think, as you'll have seen in the TNA or in the local media, there seems to be we're now pushing for trying to revert to national restrictions rather than the increased imposed local restrictions, but we'll have to see where we get with that. Next slide. Lots of discussion, the big thing on everybody's minds and why you're joining this webinar is what happens in the next couple of weeks as the children go back to school. We've had a lot of stuff from Chris Whitty over the weekend. And increasing evidence about what to expect over the next couple of weeks as well. This is a very good document, and maybe for those who are watching, we can circulate either the document or the web link to it. It's from the European Centre for Disease Prevention and Control, who do some great summaries of evidence for us. Which basically summarises some of the stuff that Chris Whitty's been talking about, how children, young people seem to be getting much more milder disease. There's very few significant outbreaks of COVID-19 in the schools, and often very difficult to detect when they do occur because children tend to be asymptomatic. Child-to-child transmission in schools is uncommon, and reopening of schools across Europe hasn't been associated with significant increases in community transmission. So there's the issue about what happens in schools, there's the issue about what happens in communities, and they're very closely interlinked, obviously. So the greater the background incidence of coronavirus in the community, the greater the risk in schools, but also then the more the schools go back, the greater risk of amplification in the community. So this is something we've got to keep a very close eye on, obviously. This is a good document. We'll circulate it. Next slide. Other things that you'll have seen, the Council's doing some great work on general advice. I presume you've all seen these. Face coverings in schools, which is the government's been given a website for updating that. General guidance, and then the CBBC tips for children, which I think is very good as well. So if you haven't got any of those, let us know and we'll circulate those. A couple of other issues before I pass on. Something that's happened in the last few days, there's been quite a lot of work on, there's been quite a lot of stuff on false news. We dealt with this during the peak of the pandemic about scare stories about what we were doing to patients in hospital. We were injecting them and killing them and all this sort of stuff. Inevitably, it just takes one or two influencers on social media to spread these, and they spread very rapidly like wildfire. The one that you may have seen is a so-called doctor in Derby saying that if your child is COVID positive, the local authority are going to steal them away from the parents. We looked into this. The doctor from Derby is a doctor of prophetic medicine. So unfortunately, I haven't been able to refer her to the GMC, but I will be doing my best to make sure that she doesn't put out stuff like that again, because it's very undermining. It's, this is the last time, this is the worst time to be putting stuff like that out. So there's been quite a big campaign to try and counter that false news. Just in terms of, I'm going to talk a little bit about Boarding Bradford just for a minute or so. For those staying on for the Stanford webinar, you'll hear more about our approaches. Our oldest children in Boarding Bradford are 13, so they straddle the primary schools and the secondary schools. We're very keen that we carry on working with doing the research that's been so important in driving the study over the next year or so. But we're also very keen to repurpose what we're doing to support schools and understanding about what's happening to the virus over the next 6 months. So there's a study that's been funded in Bristol to look at seroprevalence, so testing children using saliva for both antigen and antibodies, so both whether they have the virus but also whether they've got immunity to the virus. And we're really keen to join that. So we're lobbying quite hard with Patrick Barnes and Chris Whitty to see if we can be a second site, because strangely they choose Bristol, and actually Bristol doesn't have very much virus going on at the moment, so Bradford will be a better place to do it. So we'd need your help to that. Our goal would be to screen probably 5,000–6,000 children monthly using saliva samples. We'll be doing the teachers as well, and that, I think, would give you a very clear understanding about what's happening. It will give you real-time data. The data will feed into NHS records, so we can help with managing clusters and outbreaks, but also support you in terms of infection control in the school. So that's something that we're really keen to do, and I hope that we do get it, and I hope that you'll support us if we do get it. I think that's it from me.
Okay. Fantastic. Thank you, John. So if I can just remind everybody that we will be taking questions in the chat. So if you have any questions as the talks proceed, or if you have sort of questions in the question and answer, if you can put them in that chat function, I can then read them, and then I can coordinate this question and answer session with the sort of speakers. Other thing I want to make clear is that all the materials that the speakers talk about, we'll make sure they're captured. We'll put them all in a single repository. This is, as I say, being recorded, so we'll do an edited sort of version with any sort of sensitive bits that are taken out. So we will be making these resources available, and we're working very hard over the next couple of weeks to try and just have a single place where you can go to get all of this information. So big thank you to John. What I now want to do is hand over to Anil. So I'm going to try my video skills here. So if we can just go across. But Anil, if I can hand over to you, and if you could just sort of talk to us about your perspective as a consultant paediatrician with regard to the return to schools. Okay.
Thank you, Mark. Perhaps I can take on from where John had left in terms of how prevalent COVID-19 or the coronavirus has been. Just to give you an idea, perhaps if one were to look back, looking at the number of children that have been screened and found to be positive, for about 1 million children that were tested, only about 70 came back as to be corona positive. So that's a very, very, very tiny minority compared to the adults. So as a general rule, children don't seem to be affected at all with the coronavirus as much as the adults itself. And in fact, in our own setting in Bradford, across the pandemic or the peak of the pandemic itself, we had in total about just over 20 children who had presented to Bradford Royal Infirmary, of which hardly anybody who needed any extra support, unlike the other adult colleagues who clearly they got much more affected compared to children. And the children, even in children, it was more in terms of supportive care is all that they needed. The average stay for children who have been affected with coronavirus has been about a maximum of about 3 days or thereabouts, if you wish. So as such, corona, unlike adults, has not affected children as much as it has done for adults itself. Coming to our guidance about children going back to school, we have got some guidance from the Royal College of Pediatrics and Child Health, and they have recommended that the children can safely go back to school, and they don't think they would cause any. I think they're less likely to pass on, if you wish, or cause any spread as much as has been thought so far. The general advice, of course, is to follow what government guidance is in terms of hand washing and maintaining physical distance as much as one's expected to be doing. So in our own experience, as such, children have not been affected, or we haven't seen anywhere close to what our other colleagues have come across in terms of number of patients who have been affected from the virus itself.
Great, thank you so much, Anil. So if I can now hand over to Duncan, so we'll try and do this seamlessly. Duncan, are you there?
I think last time I spoke to you, which was a couple of months ago, we were right in the middle of the last term. I think we'd sent out some guidance to schools in terms of trying to support you on what to do if you get a positive case and how you get support from Public Health England and the local authority and so on. I'm just in the process of updating that at the moment with lots of additional information in to send out hopefully at the start of next week. And we'll make sure that that aligns well with the information that you're going to be getting from Mark. So firstly, there's no contradictions, and secondly, you'll get that sort of support on mental wellbeing and pastoral stuff within school, but also the sort of bread and butter stuff around infection prevention and control. So we'll be sending out a new document on that very soon. It's been quite difficult over the last couple of weeks because of various government U-turns and so on, and the fact that there's emerging evidence and we're getting new statements from the World Health Organization and so on. So we're trying to incorporate that as much as possible. It might be that we have to update this guidance as we move through the school term. We'll do that and we'll make it really obvious in these documents where we've updated the guidance. And another thing that I want to try and do as well is, as we started to do at the end of last term, is via the local authorities education team, send out some key messages to you all every week, updating you on the epidemiological situation for Bradford, but also on any new bits and pieces that we want to make you aware of within the guidance. So I'll quickly go through what we'll cover now, and then if there's any sort of questions for the rest of the session, you can come back individually. So the new document, as before, will contain information on how you prepare the school for cases of coronavirus and prepare the school, how you respond to individual cases and contacts, and then outbreaks as well. As before, we've got a sort of escalated levels of response. We'd like you to inform Public Health England of any positive cases or outbreaks of positive cases and the local authority as you did before. And we've got some clear guidance in there on terms of the sorts of contacts that should be excluded as well. Because the basic rule of thumb is if you're a first degree contact, i.e. you're a contact of a positive case, that's when us and Public Health England will be talking to you about like who should be excluded and going home for 2 weeks. But a lot of the sorts of questions that we got last term were about contacts of contacts. So things like, I know somebody who's a positive case and my son's gone on to play with them, but he's well, should we be excluded? If you're 2 degrees away from the initial contact, you don't need to start excluding people from school, because we want to follow that general principle of trying to keep as many children back at school as possible because of all the social and the educational benefits of that. So the new document will contain all that sort of information, those standard operating procedures and contact numbers. We're going to put something in there around face coverings, about PPE and how you can access PPE. And the council at the moment are currently discussing about supplies of free PPE and basic face coverings for schools as well. So we'll be able to update you on that in the next couple of days. And then some updated protocols on clinical vulnerability. So that's clinically vulnerable or extremely clinically vulnerable staff and children. There's obviously been some changes in that in terms of the shielding guidance being lifted, but we still want to take a precautionary approach with that and obviously reinforce those key messages around ensuring that staff that might have those vulnerabilities have got the changes that they need at work and have spoken to their clinicians if they're in any way worried. So we've got to take a very precautionary approach on that still. But I think we do have to accept that we're going into winter. Respiratory pandemics over the last hundreds of years have nearly always come with second spikes that have happened over winter months. So this situation may change again, and just sort of bear with us if we do have to change the guidance. So that's what the document will cover. And if somebody could send me in the chat, I'm looking for a head or a couple of heads if they've got any time. I know you haven't got any time at all, and I don't know why I'm asking, but it's a plea. If somebody's got time over the weekend to read through this document, it's about 20 pages long, and just sense check it so it's useful for you, that would be a really, really appreciated offer, just so we can make sure it's meaningful. So that's a sort of open question. So in terms of the update on what's happening in Bradford, John gave you some of the statistics there. The situation that we have at the moment is that we've had 6,000 positive cases in Bradford district since the start of the outbreak. We've had 550 deaths. The rate is starting to fall slowly, and the positivity rate is starting to fall slowly, as John said, which is good news because we've upped our testing. We're testing nearly 10,000 people a week in Bradford District now, which is one of the highest testing rates in Yorkshire. But the numbers of people that are positive are falling slightly. So there's some good news there. We currently know that the highest rates of infection are in parts of the west of the city. So in Manningham, Heaton, City, Toller, those wards we've got the highest infection rates. And then in the east of the city, in Bradford Moor, that's the other probably hotspot in terms of infection rates. And then all the other wards, even including Keighley, are all about sort of background rates, average rates for the district. So it's those bits of Bradford that we're most worried about, and we're doing most of our community work and our testing in. But we're still an area of intervention, as you'll know from the news. We discussed that with occasionally with central government, with local MPs, and that's a political decision whether we come out of that area of intervention or not, and that's reviewed on a weekly basis. So we'll keep you up to date with that as well. So just a couple of other things to update you on. I thought it'd be useful to just give you a bit of feedback from our experience last term. So last term, we obviously had a lot fewer children in school than we're going to expect this time. But we had about 35 schools with either outbreaks or positive cases. Most of them are primary schools or early years settings. And the numbers of staff compared to children that had positive coronavirus outnumbered by 2 to 1. So we had like double the amount of staff. So I think there's a message there that in terms of what John was saying, the evidence is emerging that we think that child-to-child transmission is not as important as adult-to-adult transmission. A lot of our coronavirus was being brought into school through adults, through household contacts. So you need, as well as thinking about your setting as a school, you need to think about it as an employer of adults, and all those sorts of infection prevention control that we do in workplaces are just as important for schools as well in terms of keeping infection rates down. So staff-to-staff transmission is a key risk. A couple of other points to mention on face coverings. Today I'm drafting a strategy permission position or sort of for the council. In light of the change in the government advice, there's 2 implications for Bradford. So first of all, it's become clear now that heads have got the discretion to use face coverings within busy social environments within schools, so in common rooms, other places such as corridors that you feel that you can't keep that 2-metre distancing going the whole time. So which I think is a positive group forward. And they've gone further to say that additional measures in terms of enforcing that face covering or making sure that you've got face covering in busy social areas within your schools has become almost mandatory within areas of intervention. So that's the big parts of West Yorkshire and Manchester. So we've got 2 reasons there why we think that head teachers, and I know you've been lobbying for this, should be able to basically put your own measures in place within those areas of face coverings. And that's a really positive thing as well in terms of children and that social messaging, social norming that coronavirus, although it doesn't affect them in a big way in terms of their health, is dangerous to their contacts. So we'll send something out on that as well. The other thing that people were asking about at the last meeting was about aerosol generating procedures. We've got about 70 children in Bradford that we want to return to school that need some sort of aerosol generating procedure, potentially performing on them in school or on transport to school. So we had a really positive meeting yesterday with members of the education sector and NHS. And we think we've got to work through for that in terms of training for staff, particularly in special schools, to be able to don and doff PPE safely and perform those measures. The sticking point is about you being able to find space within your school to do that. So we're trying to set up a risk assessment process as well between public health and the NHS, so we can support special schools about allowing you to move towards a place where you feel confident in keeping staff and children safe, should you have to undertake an aerosol generating procedure. So that's just to give you a bit of feedback on that. There has been a bit of a delay on that, so apologies for that, but we're trying to move towards it. And the final thing, I think, in terms of a bit of good news is some of you will have young ambassadors in your schools, and I've just started a piece of work with the youth services within Bradford to try and set up a shadow outbreak control board with young people. because we've seen some really useful feedback, interviews with young people about what they think about coronavirus, about the risks and so on. And it's been fascinating to see how young people, some are fearful of coronavirus because of family members or themselves. Some are fearless in terms of they just don't see it poses a risk to them or anyone else, or is even a made-up virus, the sort of things that come through the post. And some young people are just completely unaware. So we're going to start some engagement sessions with children and young people to try and develop a behavioural campaign with messages that really chime with them, that they can take back and work with you within your schools and so on, and spread amongst their peer groups, because we think that we really need to get young people on board with this, especially during this winter where we might see some pressures due to potentially rising infection rates. So that's just another little thing to let you know about as well, because you'll hopefully be hearing something about that as we move through the school term. Okay, I'll leave it there. All I say is my key message is just keep the lines of communication open with us in public health. If you think there's more than you need, let us know. If you think there's something that's wrong or isn't clear, let us know. And we'll keep that going. And the other thing is about, we will try and keep a really quick response going in terms of you from either us or Public Health England. And we want to keep children in school. So we realise that you're under immense pressure sometimes from parents to close schools or close classes. I suppose the key is get in touch with us, try and hold your nerve, and we will try and get really good information back to you. But ultimately, the decision will be yours as head teachers about which areas of the school you may want to open or close. But we'll always keep the advice open. Okay, I'll leave it there, Mark, for now.
And Duncan, we just had some questions coming in, so I thought we'll just do these as we're slightly ahead of sort of our schedule. So one of the questions referred to your mentioning of guidance to school. One of the questions was, how will that guidance be received by schools? And there's a related question, which is, will it be emailed out?
Yeah, we'll email that out. We could also put it on the thinking about it. We should put it on the COVID section of the council website. I think it came out. Basically, my main way of communicating with schools is via the education team. So I'm Mariam Hack's team within local authorities, who I believe sends you out regular updates. So we'll make sure that will go out to all schools via those routes. If that's not right, let me know. If that's not getting through to you in that way.
That's great, Duncan. We're really hearing this message. If it doesn't work for schools, let us know, and we will do what we can to improve lines of communication and any other aspect of the whole system response. Another question to you, Duncan, was, will independent schools have access to PPE and face coverings that are being provided by the local authority?
I don't know is the answer to that one. I'll send a letter. I'll send a mail back. I'll try and find out from the education team what's happening with that.
Brilliant. And can we then get that messaging back to the independent schools one way or another? Yeah. Fantastic. Yeah. Thank you. And I've just seen a question pop up in chat, which is how to ensure that we're on the mailing list if we're not currently receiving the sort of a guidance. Who do they contact?
I think probably the main thing to do is that presumably all schools have got local authority contacts, with whether they're academies or state maintained. So that would be the way to do it, and then that would eventually come back through to me.
Okay, thank you, sort of Duncan. I think message to everybody: if we can play any role in this, I'll put my email up. Just let us know. We'll make sort of things that are happen. We've all got to work together here, so just get the message into the system one way or another, and we will try and sort of sort it out. And final question, Duncan, before we hand over to Sasha, is, should the schools be requiring all staff to wear masks and or visors?
I think if you can't maintain social distancing, that's absolutely essential. So in the classroom, for classroom environments, we're still saying that it's not essential to wear masks or visors. But in terms of walking around the corridors, if you can't maintain social distancing because you haven't got enough room in staff rooms and things like that, queuing in canteens and all that sort of thing, I think the approach that we need to move towards now, particularly because Bradford's an area of high rates of infection, is that we need to be moving to a position where schools are expecting staff to be wearing face coverings in those areas. But I think one of the things that we've got to remember is that there's risks associated with having hundreds of additional masks in schools as well, because there's a sort of false sense of security, and we don't want other protection measures such as hand washing and social distancing to disappear just because people are wearing masks. There needs to be safe disposal of them. Some children with either sort of emotional or physical health problems, it may not be appropriate for. It might cause them extra stress as well. So we've put some of these sorts of reminders in, and so the face covering's got to be seen as one of a range of interventions in schools in terms of reducing COVID transmission. It can't be seen as a sort of, right, we're doing face coverings now, so we're all going to be safe and kids can hang around and, in really, really tight groups anymore. We've still got to do the hand washing, and social distancing is still probably the two most important interventions, because the evidence on face coverings isn't strong, actually. It's there seems to be some evidence emerging that it can help in reducing transmission of respiratory viruses in sessions, but coronavirus has been around, it's only been around for 6 months. We haven't got that high quality evidence coming through yet about schools, but I think it's now we're moving to a policy position where masks need to be worn in those sorts of busy areas within schools. Yeah.
Okay, thank you so much, Duncan, and a huge thank you to Alice from the Education and Learning sort of a team who's going to make sure that all this sort of messaging is delivered. So thank you, Alice, so much for that, and thank you so much for Duncan. I can see some other questions popping up in the chat. Do keep those coming, but we'll save those now for the question and answer session, because to keep us on schedule, what I want to do is hand over to Sasha. So Sasha, I'm going to try and bring you full screen. That's happened. Thank you so much. Duncan nicely segued when he talked about the social and emotional factors that we need to consider. So can I hand over to you to talk us through all of that? Thank you, Sasha.
Hello everyone, my name is Sasha Batt and I'm the Head of Mental Wellbeing for the Council and for the NHS in Bradford and Craven. So I guess I wanted to talk about three things. One is access to mental wellbeing support, what we're doing in schools and how we can work together, and some of the resources that we've put together to share with you. So the first is looking at how children and young people have experienced mental health issues over the past months, and not just in terms of mental health issues, but also that they're social emotional issues. And the main things that we do know, one, that when we look at our services, how they are currently being delivered, we have seen a decrease in access to some of our specialist mental health services, but we've seen a huge increase in the access to some of our digital and lower level mental health support, which is delivered via CAER and Healthy Minds. And the issues and the reasons why young people are getting in touch, and these are the things that when schools open, young people will start talking to you about, have been issues around their sleep, so sleep difficulties. We've seen almost 230% increase in how much young people and children are speaking about difficulties with sleep. They've been talking about issues around family relationships. There's been issues about disclosure of abuse, but also we know from our safeguarding colleagues that they've seen a huge drop in the number of children coming forward or being aware of safeguarding issues with children. We've seen children expressing and talking to our practitioners about their worries and concerns about their exams and school, and generally around school and college work. For boys and girls, there's been some marked differences. So with girls, we've seen an increase in them talking about depression, talking about self-harm, talking about anxiety, and talking about friendship relationships. Whereas for boys, we've seen an increase in suicidal thoughts, in also low mood, but not necessarily talking about that in terms of depression, talking about self-harm, and talking about stress and worries and bullying. So those have been some of the issues that we've seen an increase in young people sharing with us, and some of the support that we've put in place to meet some of those needs. So those have been increasing the number of counselling hours we have, increasing the support to young people, both through peer support, but through how the youth service have been working face to face, how our crisis service have been providing support not just to young children and young people, but also to families and to parents and to caregivers about those conversations about family relationships, about managing being in closed environments, feeling like they're locked up. So those have been some of the issues that we've put together. What we have done is used a lot of that feedback and pulled together a pack that we've prepared for schools. And in the same vein as Duncan, we've got a pack that we would like to test out with yourselves and get some information to see if we've put the right information in there for you. What that pack does is provides a really clear way of how you can access support, what support's available to you as a school, what information our educational psychologists and our mental health support teams that we have in schools, how they can work together to support children, young people, but also we've got some young people apprentices who are really looking at that peer support element, really understanding how young people and children are expressing their social emotional needs and what they feel works for them and what is useful for them. So we've pulled together that pack, and again in the same vein, if we could have 1 or 2 volunteers who could help see if that provides you with the right information, if it's in the right language, and also what might be missing from it that we can start to build and work together with you on. And then finally, the other thing that we've done is really look at our general referral pathways and what support we can provide. So we have partnered with the opportunity area and provided mental health support, mental health first aid into some schools, but also looking at how we really streamline that approach of children and young people getting to specialist support if they need it. And what we've done is really refresh the whole pathway of referral into children and people's mental health services. And we're in the process of just developing the standard operating procedures for that. So again, would be great to have a head teacher or somebody from the schools to look at that and see if we're on the right track in terms of hearing the feedback we had from you previously, and if we've addressed those concerns that we heard from you. So those are some exciting developments in terms of looking at how we move forward. But a lot of work happening and things put in place to provide some support. And we've tried to really make that easy through Guideline, which is the telephone support for parents and young people and for all ages, through Healthy Minds and through COOF being available in schools, and looking at how we can make sure that support's available to you. So yes, happy to take any questions.
Fantastic. Thank you so much, Sasha. What I'm going to suggest, because you've kept us beautifully to time, is that actually we ask people to save those sort of sessions up for after the break. So you've actually given us an extra couple of minutes. So we'll give people an extra couple of minutes to get their cup of tea or take a sort of a comfort break.